Hello everyone, Namaste. I am Dr. Sameer Paranjape. Today I want to share my journey. When I was in 10th standard, it was very difficult to to complete the 10th standard uh, syllabus and to pass the exam. At that time, my English was very bad. Even I couldn't understand the meaning of words, and being a student of a rural area, it was difficult to express. It was difficult to write down, and somehow I completed my 10th standard, and I took admission for 11th standard in science branch because my friend took admission for science, and I'm grateful to my friend because at that time I was not having any idea what kind of branch it is and how it will go ahead. But I just accompanied my friend, and I took admission, and all the subjects were in English. And for 1 year, I was trying hard to understand what teacher is saying, was saying, and I just mug up everything, and somehow I cleared 11th standard science batch. And when I started taking lessons in the 12th standard, one day our chemistry professor told that you people study hard in this year so that in the future you people can become a very successful person if you get an admission for good course. Somebody will become doctor, somebody will become engineer. If you don't study, then you will have to work hard somewhere, and you have to do job. So by listening to his words, I started studying very neatly, and at that time was also it was difficult to understand English, but somehow I managed. One day, I called our veterinary doctor at my place. Our buffalo was having a infected wound, and that was non-healing for not healing for more than 15 days, and there were maggots and there were foul smell, and my parents were not there. So he gave injection he injected antibiotics to buffalo, and he was talking to me over a cup of tea, and he asked me, what is your future plan, what kind of study, what kind of stream you want to go with. So at that time I had no idea what to do next. So I told him I will do BSc, and being a priest, I will do the priesthood. So he said, you should not think in this way. You can take admission for BMS course, and for that there is a CET, common entrance test exam, and that you have to clear, and I will support you, I will help you in all the way. So I thought to give CET after 12, and I scored good, and I attended the centralized admission process in Mumbai, where that veterinary doctor Bangar came with me for that process. And actually on that day I couldn't get admission, so on the next day I had to stay over there. So on the next day again I went, and he came back home, and I attended rounds, and somehow I got admission for BHMS, not BAMS. And actually I was trying hard to get admission for Ayurveda, and it was not possible. So I took admission for homeopathy, and when I went to Dhule, by looking at surroundings and buildings and everything, I was not happy. So without submitting all the papers, I came back home. And in the next month, for next round, when I attended, they said your name is not in the list because you didn't submitted your papers in college. So now you are out of race. So that was shock for me, and I was not having any idea. So for whole year, it was like I was in depression. And in the next year again I prepared for CET, and meanwhile I took admission for BSc course also. For 1 year I completed BSc first year, and I took admission in the BSc second year also. And one day, meanwhile, I was trying hard to get admission somewhere in Maharashtra in Ayurvedic college. So my uncle, Dr. Suhas Joshi, was helping me at that time. So after 15 days, 1 month, I used to call him, is there any college to get admission? But somehow it couldn't work. So one day, after 1.5 years, my uncle called me and said, there is one college in Goa, Shiroda. So only two names, Goa and Shiroda. Only two references, means one reference about the name of college was there, name of village where that college is located, and there is only one Ayurvedic college in Shiroda, Goa. So I called, means I connected trunk call, dial trunk call in Thane, and I got a number from Thane office of Goa exchange, and they connected to college number. They found out college number and they connected to college. And I called them, I asked the address, and somehow I reached Goa by train. And that was first time I visited Goa alone without parents. And when I saw college, first time I just bowed down to Lord Dhanvantari, and I entered into college, and I completed all the formalities. And after visiting twice or thrice, I somehow I got shortlisted on 11th rank on the basis of my 12th marks. And I took admission finally in first year BMS Goa. And my journey started from the day first, and all the teachers were very nice. And again there was problem of English. For whole 1 year it was very difficult to just understand what professors are teaching. But somehow Sanskrit made me easy to learn to by heart all those things. And somehow I wrote papers, and with hard work I got second rank in first year BMS. All students, my colleagues, were very helpful in that endeavor. And I cleared all the exams, second year, third year, all the exams. I am very much grateful to Dr. Hebli sir, Dr. Dikshit sir, Dr. Panse sir, Dr. Kurde sir, Dr. Mohanty ma'am, Dr. Bale ma'am. All those were teaching us in our first year BMS class. And in second year, third year, same professors and other professors were also there. Dr. Bhagwat sir, Dr. Karle ma'am, so many, Dr. Das sir. I remember all of them, and I'm very much grateful to all of them, because guy who belongs to rural area, remote place, he was not able to understand English well, but they helped me a lot to clear all the exams by teaching very nicely. And I completed my course, and then I took transfer from Goa to Tarachan Hospital, Pune, Tilak Ayurveda Mahavidyalaya, where I completed my internship in Tilak Ayurveda Mahavidyalaya and Tarachun Hospital, and then I did some courses also, and some duties in Sassoon Hospital, and in Y also I completed my internship. And when I came back to my native place for a few days just for a vacation, some ladies started coming to me and they were asking for medicines. As I was just passed out from college, I started giving them medicines, and somehow my confidence also started improving, and I started treating those ladies or other people who were working at our place. And in a span of 3 months, I got sufficient enough confidence to treat patients. And after 3 months, I started my own clinic at my native place. And at that time, I was practicing allopathic medicine. And one day, my father told that now your clinic is running well, there are number of patients coming to you, they are getting good results, but I am not happy with your practice. I said, what's wrong with this? I am happy, I am earning money. My father said, being a BMS practitioner, Ayurvedic doctor, you are not doing well in Ayurveda. You are doing everything allopathic practice. You are injecting medicines, antibiotics, and painkillers to patients. So my dream was something different, and you are doing something else. So I told my father that practicing Ayurveda is a difficult thing, so I have to study more in depth. So he said, okay, then no problem, you can do MD. So again, I started giving entrance exams in various states in different colleges, and somehow with good rank, I got admission in Pune in Vagoli, and I got admission for Kaya Chikitsa subject. There is also one more story. Actually, I wanted to study Samhita, Ayurveda Samhita in depth, but when my uncle Dr. Suhas Joshi accompanied me to means helped me to go to Bagoli, when we were sitting in Sardeshmukh sir's cabin, director's cabin, Sardeshmukh sir told that we will not give you admission for Samhita subject. You should take admission for Kaya Chikitsa, that is medicine, Ayurvedic medicine. And I was not actually happy to take admission. And my uncle said, Dr. Sardeshmukh sir is my teacher, my professor, and I can't argue, I can't ask any question in front of him. So if he is insisting to take admission for this branch, Kaya Chikitsa, that is Ayurvedic medicine, you should take it. And actually, unwillingly, I took admission for Kaya Chikitsa, and fine. Before that, I want to tell you something different story. When I was in internship, my friend Abhijit Munshi from Nagpur, he was doing internship in Nagpur, and one day he called me and he said, there is a, a stalwart aged professor. He gives nice lectures to Ayurvedic students, and in one lecture he heard that who says Ayurvedic medicine can't work very fast, you people can't diagnose the condition. So Ayurveda is not at fault, you people are at fault. So actually I fascinated with his words, and at that time it was very difficult to go to Nagpur and attend his lectures. So there was a wish in my mind, in my heart, to study under him. And his name is, I will reveal his name afterward. But when I took admission for Kaya Chikitsa in Pune for MD, when I entered in the department of Kaya Chikitsa, a professor, aged person, was teaching Ayurveda chapter to MD students, MD scholars, PhD lecturers, readers, professors, all were sitting around the table, and they were finding references from Charak Samhita. And this professor, without having any reference book in front of him, he was teaching continuously for 1.5 hours. So that lecture was a lovely one. Means I can elaborate, I can explain all those topics right now also, but that is not the point to explain in detail here. But I was stunned by listening his lecture. And when lecture completed, everybody started moving out. I asked my senior, I remember the name of senior, Shriram. I asked Shriram, who is this professor? And I'm very much glad to see him. And actually, he said, he's our Dharmadhikari sir. Wow, the person about whom I was listening from a friend during internship, that person was a professor HOD of this department of Kaya Chikitsa. So it was a lovely moment for me. And then I totally got surrendered to him, and started learning Ayurveda from Dharmadhikari sir. And continuously for 3 hours I studied under guidance of Dharmadhikari sir. I took lessons not only from Samhitas, but in a real practice in a hospital, how to handle patient, how to diagnose patient, how to understand conditions. I studied, I asked so many queries, and in a span of 3 years, I got a lot of confidence of speaking and diagnosing patients and treating patients in a nice way. So I'm very much grateful to Dharmadhikari sir. And when I started, means when I completed my MD, I was thinking that now I should settle in Pune. So I found one apartment, one block flat where I can start my practice. So I asked Dharmadhikari sir, now I want to start my practice in Narayanpet, Pune. So while listening this, Dharmadhikari sir told, you should not practice here in Pune. There are so many Vaidyas, doctors practicing here. You are needed where Vaidyas are not practicing. So you should go to your native place and you should start your own practice. So again, I came back to my native place in Kherdi, Taluka Dapoli, and I started my Ayurvedic practice. And by God's blessings and our teachers, professors' blessings, I got good grades, and also job in MES Sarad Mahavidyalaya Lote, where I started my teaching career also in 2012. And for 6 years I taught subject Swasthavrat and then Balarog and Panchakarma, and then I resigned from there. Meanwhile, I also started practice at my own clinic in Kherdi and in Mandangad in the Shraddha Multi-Speciality Hospital for 1 year. Then I got married with Z, and for last 12 years I have been practicing Ayurveda here in Dapoli, Kherdi, and now there is a good response for Ayurvedic treatment. Many patients from vicinity, from village and taluka place come to me for Ayurvedic treatment, and from district places, from other cities, metropolitan cities, from other countries also, many patients come to me for Ayurvedic medicine. And I'm very much thankful to all my teachers who taught me all the lessons and how to diagnose patient, how to treat patient very nicely. So I'm very much grateful to all those teachers, professors, mentors, and only the thought of gratefulness towards them is the thing is in my mind. So I'm very much thankful to them. When I started my practice, um, some interesting cases came to me. I remember when I got a call from patient's home that please come to my place uh, to see my wife. She's tossing in bed due to severe abdominal colic. So I visited her home, and at that time I was not having the referral sheet also for sonography. So I wrote USG abdomen, and I told them it is a very common cause that maybe we will find in sonography, but it is due to renal colic. So that was my first patient in a severe painful condition. She called me, he called me, and with some other drugs and decoctions, some medicines, her renal stone got cured in a span of 15 days, and in the next follow-up, in the next sonography, that renal stone was disappeared. So I was very much glad at a time, and many cases came to me for renal colic, where I used to tell them, don't take painkiller injections or any other allopathic medicines for renal colic. Just come to me directly at any time at 2 p.m. or 2 a.m. also at night, and I will give you basti enema. I will do all those things to relieve your pain. Then you can go. So for last 10 days, I have been treating cases of renal colic, severe acute pain in renal colic, ureteric colic. So I treat such cases here in village without giving any painkillers injections. So now hundreds of renal colic patients I have treated, and not only renal colic patients, but there are so many patients of acute exacerbation of asthma in children or in elderly patients also. I have treated very nicely with Ayurvedic medicines. So all those are emergencies. Generally, people say it is a general conception of people that Ayurvedic medicines works very slow, but with the confidence, with the experience of 12 years, I can say that there are many conditions in which Ayurvedic medicines can do wonders, and without giving painkiller injections, we can treat patients with Ayurvedic medicine. So it's a nice lesson, and of course, in some cases, I referred those patients to hospital, because in that condition, in the first few years, I couldn't treat them with Ayurvedic medicines, so that was my failure. But I didn't injected painkillers to them, and I studied more how I can conquer that condition to relieve pain, and slowly that confidence came, and I tried many medicines to alleviate pacify pain. And one more thing I want to just share. There was a patient of CA pancreas, and he came to me and said, doctor said that there is no way remaining, there is no option of chemotherapy or radiation therapy or surgery. So now death is now only the way to just come out of from this condition. So patient said, I know within few months I will die, but you should help me to die peacefully. So I said, okay, no problem. I took written consent from patient and his relatives, and for 1.5 month I treated him with Ayurvedic medicines, and patient died peacefully without taking painkiller injections, and he got pain relief with Ayurvedic medicines. So my confidence level boosted, and in those days that patient told that I can experience how your medicines work in this condition also. So you should be patient. You should not go anywhere else. You should stick to your principles, and you should stick to your one place. People will come to you. So don't deviate here and there, and just do your work at one place. So that was blessings given by CA pancreas patient. He died peacefully. Then there were some other cases: intracranial hemorrhage, patient admitted in ICU in a very renowned hospital in Kongan, from where they gave discharge to patient because that condition was not easy to treat at that time over there. So they gave discharge, and they said, now this patient will die in 3-4 days, so you just take her away to your home. And now relatives called me to check her, and within span of 7 days that patient came out of coma. She responded well, and in the span of 6 months she could speak a few words, she could smile, she could eat by sitting in her bed, and she could take her grandchildren in a lap. So that was a nice moment where a patient who was in coma, and doctor who said this patient will die in 4 days, that lady after 6 months she could take her grandchildren in her lap. Then after 6 months patient died with some other cause, with heart attack, but that is a different story. But at least patient could come out from that coma due to intracranial hemorrhage. And that was a nice moment for me, where patient just came out from coma, and she took out all the catheters or Ray's tube in her nostril that she just took out, but somehow we managed, and she started improving. So that was one more case that I can elaborate well. Somewhere I will definitely write about that case in detail. Which treatment was given at that time. I have all the papers with me. One more case from Kherdi. That lady, old lady, was a case of renal failure, and doctor said now she should go and undergo dialysis, and she will not survive for not more than 1 or 2 months. So they called me for visit, and when I visited her, I just sat beside her, and in that critical condition also she said, give chair to doctor. So I thought, if this lady in this altered sensorium also, if she can just point out this thing, then her brain must be working in a good condition. Though her consciousness is not good, consciousness level or sensorium is altered, still if she's offering me a chair to sit, then definitely I should work on her. And I started treating her, and in span of 4 days she started improving, and on 5th day she had a bath by her own. Her swelling on her legs, on her face, dyspnea, difficulty in breathing also came down, and she survived for more than 5 years. So that was achievement with Ayurvedic medicines, without dialysis. being a diabetic, being hypertensive, being renal impairment, she could survive for 5 years. That is an achievement, lovely thing. So I remember that lady. Now she died, but I got famous due to such cases when I treated in my previous years. So I'm very much thankful to all of them who had faith in me. So there are so many cases that I can tell you in detail, but now I should stop somewhere. On some other day, I will see you again. Have a good day. Bye bye.